Joining us again to talk about the latest COVID news is Dr. Ali Hassoun, infectious disease specialist with Huntsville Hospital. Thanks for being with us again tonight, Dr. Hassoun.
Thank you for having me.
I saw the CDC now says we are at 65% of Americans 12 and older fully vaccinated. Is that close enough to herd immunity?
I think it's getting there. I don't think it's yet because, with the Delta variant, we've seen even with vaccinated people had issues of infection as well. I think we're getting there definitely, and people is more willing to do the vaccination. So that's really great news.
Well, some people are still not willing to get the vaccinations. The president came out with a vaccine mandate. Some hospitals now, we hear, are firing healthcare workers who choose not to get the vaccine. These are the very people who pulled us through some of the worst of the COVID pandemic. Should they be fired for simply choosing not to get the vaccine?
Yeah, I'm going to say this will be a difficult question to answer in the way of what's the rules, what the policies of each hospitals, how to deal with certain protocols. There's a lot of things ins and outs in these. What I would say at the moment, vaccination is the fastest and the safest way to get over this. And that's why you see some of these businesses requesting and recommending or mandating these. It's difficult to see people fired, definitely. But at the same time, there's going to be a way of we're encouraging, pushing people to do a little bit more. But if that doesn't work, there's going to need to be other mandate put in.
Is this happening at Huntsville Hospital?
No, it has not. And I don't think there's a plan at the moment to do that, from my understanding.
We are learning about a new pill being developed to treat severe infections. Can you tell us any more about that?
Yeah, so if you're talking about the one that announced by Merck, actually, this pill actually can be given in the outpatient setting, not in the hospital. So it's like how you use what we call Tamiflu for the flu. Use this tablet to help with COVID patient. And what's it shown? And this is very preliminary. It's phase 1 and phase 2 studies. They're going to start phase 3 studies soon. But it would have shown actually encouraging in the way of reducing hospitalization and reducing severity, as well as possible reduced transmission. So these are very, very good news if we really have phase 3 data and prove to be the same.
Another tool on the belt, so to speak, to help us in this fight against COVID-19. Dr. Ali Hassoun, thank you very much for being with us tonight. We appreciate it.
Thank you so much.